Hello, I'm Dr. Lisa Stout from Cloverleaf Animal Hospital in Lodi, Ohio, and today I'll be talking to you about cat vaccinations, and my assistant will be helping as well by asking some questions to kind of pinpoint a little bit more about vaccines and why they're important for the overall health of your cat.
All right, Dr. Stout, what exactly are cat vaccinations?
Vaccinations are basically vaccines that provide immunity towards certain illnesses for what we're trying to protect in the kitty.
Are cat vaccinations necessary?
Yes, they are absolutely necessary. They're an essential way to protect your cat from acquiring or lessening the illness itself, depending on what they have. So there are different vaccines that protect for different things. One of the most common things that we see in kitties are upper respiratory infections. So there are several different vaccines that we include as far as our preventative care to that the cats do receive the proper vaccines for what they're being exposed to.
What cat vaccinations are typically recommended and what are they for?
So it's typically at Cloverleaf Animal Hospital for our indoor kitties with no exposure to outside. We always recommend the feline, it's called, sometimes people refer to it as the distemper vaccine, but it's actually, the distemper part is the panleukopenia, but there's usually other elements such as herpes or chlamydia or colici that actually is in with that vaccine that protects them against upper respiratories. As well as a rabies vaccine. Each state is different as far as their requirements for rabies. And so the state of Ohio actually has different mandates for different counties as well. But even with that being said, it is important for cats to be vaccinated, especially if they're outside, because rabies is a zoonotic disease. And that means that it can be transmitted from animal to animal or actually animal to human through bites. And so unfortunately, we still have that. It's out there. We don't see a lot of it, but unfortunately, we still have rabies. So it is important for them to be vaccinated for that. So those would be the two, again, that we would recommend for indoor kitties. For outdoor kitties or indoor kitties that have exposure to outdoor kitties, we do recommend having the upper respiratory, the rabies, and the feline leukemia vaccine. Feline leukemia is a virus that affects their immune system, and over time, unfortunately, it does affect their overall quality of life. Typically, because of their decreased immune system, they can get sicker, or they can unfortunately have a little cold that they don't get over because their immune system can't fight it off. So it is important, again, for them to be vaccinated. Most cats contract the feline leukemia or the FIV, which is the feline immunodeficiency virus. So it's very similar to the leukemia because that also does affect your immune system. But there's not a vaccine that's actually efficient for FIV, but both of those are transmitted through bite wounds. And so it is something that the cat should be vaccinated for. And lastly, you might hear of FIP, and that's feline infectious peritonitis. It's been many, many years since an FIP vaccine was actually available. They removed it a while. I don't know. I mean, it's been a long time, but when it first came out, they weren't quite certain of the efficacy. And as more and more clinics used it or trials were done and research was done, they found that unfortunately it was not effective for protecting against the feline infectious peritonitis. And so there is not a vaccine available anymore for that as well.
And what is the vaccination schedule for kittens, adult cats, and senior cats?
So this varies a little bit from personal preference and also just from, I think, again, what veterinary clinics do. But here at Cloverleaf Animal Hospital, we actually will start off our kitten vaccines between 6 and 8 weeks of age, and they finish their vaccines usually between 16 to 18 or 20 weeks of age. For adult cats, if they've never been vaccinated, or maybe it was a stray kitty and we don't know their vaccine history, they typically, if they're over a year old, they will get a series of 2 vaccines, and they're usually 3 to 4 weeks apart. With the kitten vaccines, they are given every 3 to 4 weeks apart as well until they reach that age satisfaction at, like I said, between that 16 and 20 weeks. And then as far as our senior kitties, we do recommend vaccinating if they've been vaccinated from a kitten through adult. Once they're over a year old, they will then be vaccinated for the vaccine that we recommend every 3 years.
Are there risks or side effects associated with cat vaccinations?
So there are some risks that are associated with the cat vaccines, but they're very, very rare. Most generally, when we're giving vaccines, if we're giving 1 or 2 vaccines, and again, there are different types of vaccines, and I'm not going to go into all that detail, but depending on what vaccine you're using, whether it's a live or a modified live, there can be some more reaction to it. So we here at Cloverleaf do choose to use vaccines that are less reactive. And so that is our goal too, so that we don't have any type of vaccine reactions occurring. But the most common vaccine reaction that we see is basically the cat would be maybe a little bit lethargic after receiving it, maybe wanting to go home and lay a little bit around because they developed a little bit of a fever. Maybe they're off feed a little bit for the first 24 hours, but usually after 24 hours, they're back to, normal. It's a little bit similar to like when we get a vaccine and you've got a little bit of discomfort at the injection site, or maybe you get a little fever, but it doesn't last very long. So sometimes that does occur, but it's more common if more than the more vaccines given. So we typically will try to give no more than 3 vaccines at any given time. I do recommend a lot of times if it's a smaller kitten, or if it's a cat that maybe has some other medical issues going on and they're due for all their vaccines in that year, that we actually split up those vaccines. So we're only giving 1 vaccine at a time, so that there is that decreased risk of them potentially having any problems. There has only ever been 1 time that I've seen a severe, what we call anaphylactic vaccine reaction on a kitty. I think, again, it's like 1 in 10,000 occurrences, but that doesn't mean it can't happen. And so unfortunately with this kitty, they did have some facial swelling. They got very itchy. It can be severe to where they can have difficulty breathing, and it can even be fatal, unfortunately. So that's not to scare people, but it is, like I said, something that can occur. It's just very, very rare. And those are usually when they have been given a lot of vaccines at one time.
If my cat is going to strictly live indoors, do they still need to be vaccinated?
Yes, so we absolutely recommend indoor kitties to be vaccinated. People will say, well, why? If they're indoors and there's no exposure. Vaccines typically for an adult cat their immunity lasts anywhere from about 3 to 5 years. And so there's a lot of vaccines that are available, but we don't have a way of determining that immunity. There are some titer tests that can be done. They're usually very expensive. And so owners aren't, wanting to really look at that aspect of, oh, do they have immunity or not? But if 3 years have passed, they're going to say, okay, it's time to vaccinate so that we build up that immunity. So for indoor kitties, typically, as their immunity wears down, if we're bringing in another kitten, maybe from a shelter, or we found a stray and we brought it in, we want to make sure that cat or that kitten is in a carrier or something. And if they aren't vaccinated, or their immunity unfortunately is low, then they are at risk of contracting something like maybe an upper respiratory. And so for indoor kitties, again, we do recommend that they're up to date on their upper respiratory and their rabies vaccines.
Okay, and why is it important to avoid missing a cat vaccination?
So typically, when we see missing vaccines, it's usually where maybe we did one or two vaccines in the kitten series, and then the owner forgot or something came up and they missed it, and then they say, "Oh well, I thought that they were done, or it wasn't important to get that last vaccine." So the way kitten vaccines work is you really are building up your immunity. So the first vaccine is given, and then the immunity starts to decrease after 3 to 4 weeks. So we give it another boost. And so it is, they're made to boost through their developing time as well. And so it is important that you complete your kitten series. If by chance they only received 2 vaccines as a kitten and we're seeing them as an adult kitty, and we know that they did not complete their series, then we're going to treat that cat to say their immunity wasn't sufficient during that time. So we're going to suggest reboosting that immunity, so they would get 2 vaccines in a series. So we give one, and then it would be boosted in 3 to 4 weeks, and then they would be good for the year. It is important, even as an adult cat, if you say, "Oh well, we did fine, we completed the vaccines as a kitten, we got in at the yearly, or maybe we got in at 2 years as well, and then time kind of went by, and now my cat's 6 years old but hasn't had a vaccine since 2 years of age," we still recommend bringing them in for their yearly exam, and then we would update the appropriate vaccines at that time.
And if clients have more questions regarding cat vaccinations, what should they do?
So if you have any additional questions on vaccines, you're more than welcome to contact us. We'd love to hear from you. I know sometimes it can be overwhelming, especially if you're reading things or you have other people saying, "Oh, they need this," or "I recommend this," or "You do this." And so sometimes it can unfortunately be a little bit stressing to figure out what your cat needs or what your kitten should be getting to stay healthy and protected. So we would be happy to talk to you more about it, and you can give us a call or check us out on our website.